Allergies and the flu are two distinct conditions that often get confused due to some overlapping symptoms. Allergies are the immune system's response to a harmless substance, such as pollen or pet dander, causing sneezing, itching, and a runny nose, while flu symptoms are more severe and include fever, body aches, and extreme fatigue. Treatment for allergies often involves antihistamines, nasal sprays, or allergy shots, whereas the flu may require antiviral medications, rest, and plenty of fluids. Individuals can reduce allergy risks by avoiding known triggers and improving air quality, while annual flu vaccines are recommended to lower the risk of influenza. Here's a more detailed exploration of allergies and the flu, highlighting their distinctive characteristics and management strategies. Symptom onset, gradual versus sudden. Allergies and the flu often share common symptoms such as sneezing, coughing, and a runny nose, leading to confusion in self-diagnosis. However, a key differentiator lies in symptom onset. Allergies typically manifest gradually as the body encounters and reacts to allergens, such as pollen or pet dander. In contrast, influenza symptoms can appear abruptly, often within a few hours to a couple of days after being infected with the virus. The sudden onset of high fever, chills, muscle aches, and fatigue are more indicative of the flu than allergies. Recognizing these onset patterns helps in seeking appropriate treatment, antihistamines for allergies and antiviral medication for the flu, along with supportive care. Fever presence, absent versus present. Allergies and flu often cause confusion with their overlapping symptoms like sneezing, coughing, and a runny nose. However, the presence of fever is a distinguishing feature. Allergies typically do not cause fever. Instead, they're characterized by itchy eyes, sneezing, and nasal congestion without the systemic symptoms seen in infectious processes. On the other hand, the flu often presents with a fever, a body temperature of 100.4 38 degrees Celsius or higher. This fever could be accompanied by chills, body aches, weakness, and severe malaise, indicating the body's immunological fight against the viral infection. Recognizing this symptom can help accurately differentiate between the two conditions, guiding appropriate treatment. Time of year, seasonal versus anytime. Seasonal patterns play a crucial role in differentiating between allergies and the flu. Allergies are often linked to specific times of the year when pollen counts are high, such as during spring or fall. Patients typically experience recurrent symptoms annually around the same time, aligning with the blooming or withering of certain plants. On the other hand, the flu is less predictable and can strike at any time, although it tends to peak during colder months, particularly in winter. Influenza outbreaks are influenced by the circulation of the virus, which changes yearly, leading to varying peak times. Knowing these patterns enhances accurate diagnosis and informs preventative strategies, such as vaccination timing for flu and allergen avoidance for allergies. Symptom duration, persistent versus temporary. Allergies and the flu often present with similar symptoms such as runny nose, sneezing, and fatigue. However, a key differentiator is the duration and pattern of these symptoms. Allergies tend to be persistent and long-lasting, often flaring up in response to specific triggers like pollen, dust, or pet dander, and will continue as long as the exposure to the allergen persists. On the other hand, the flu is usually temporary, with symptoms peaking within the first few days and gradually improving over 2 weeks. While allergies can cause discomfort for extended periods, flu symptoms, although more intense, resolve as the body clears the infection. Response to antihistamines, effective versus ineffective. When distinguishing between allergies and the flu, the response to antihistamines is a telltale sign. Allergic reactions are often effectively mitigated by these medications since they directly target the histamine, a chemical your immune system releases during an allergic reaction. Symptoms like runny nose, sneezing, and itching can be alleviated, pointing towards allergies. Conversely, the flu caused by the influenza virus does not respond to antihistamines, as its symptoms, fever, muscle aches, and fatigue, are not histamine-mediated. If a patient's symptoms persist or even worsen despite the use of antihistamines, it likely indicates the presence of a viral infection such as the flu rather than an allergic reaction.